So with these considerations in mind, we have reset all our testing and isolation procedures into a simple, what we call the 1, 2, 3 protocols. Because there are only 3 procedures from henceforth. And these 3 are like 3 lines of source codes or 3 building blocks that can cater, we believe, to almost all situations and circumstances. And they are as follows. Protocol 1 is when you are unwell and you have been tested positive. For example, you fell sick, you see a doctor prescribes a test, and you turn out positive. What do? You are then required to stay home, isolate yourself, and MOH will contact you on your recovery, whether through the home recovery program or be brought to a healthcare facility. And if you are vaccinated, you will be discharged in 10 days. If not, 14 days. There is no more day 6 PCR swab and discharge. There is no more day 6 PCR swab for early discharge. Discharge will then purely be time-based. So when the time is up, the alert in your trace together will be automatically lifted. Protocol 2, you are well, no symptoms, but tested positive. This usually happens when you participate in your company's or your employer's routine testing operations, and then you test yourself positive. What do? This is an existing protocol that has been published repeatedly in the papers. So what you do is isolate yourself for 72 hours or 3 days, and thereafter test negative for ART to exit isolation. And if your conditions worsens, see a doctor. And the doctor will test you and look at you and see if you have been infected. And if yes, follow Protocol 1. Final one, Protocol 3. You have received a text from MOH that you are a close contact. Could be a colleague, could be a family member. You use the notification to withdraw ART test kits at the vending machine, and then you follow a 7-day procedure. First day, you are required by law to test yourself with an ART kit and then upload the results. After that, test negative before you go out on the same day. On day 7, test yourself for the last time and then exit the procedure. Anytime you don't feel well, go see a doctor. And if positive, refer to Protocol 1. Anytime your ART test turns out positive, refer to Protocol 2. So with this, that is all. With this, we effectively merge quarantine, healthcare warnings, healthcare alert into one test procedure. And we have effectively replaced lengthy quarantine period with a testing procedure that allows for flexibility without compromising public health. The new procedure will be effective next Monday, 11th of October. I want to also urge various companies, employers, regulatory agencies to try to align existing practices to these protocols.